Hi Luke, welcome to our clinic.
Hey.
I'm Sarah, I'll be your physical therapist. We're just going to start out here by reviewing the health history form that you filled out, just so I can get a better idea of what can be going on with you, and then we'll move into the examination. Alright, so I see that you're having some knee pain with squatting, and can you tell me a little bit more about what's going on?
It pretty much just whenever I squat, it just hurts.
Okay. And where around the knee does it hurt?
Kind of at the proximal part, kind of very top of the kneecap.
Okay. And how would you describe that pain?
Maybe like an ache. It's really weird to describe.
Okay, so maybe achy.
Yeah, and then every now and then, when I do get down, and after I get down, I can kind of pinpoint exactly kind of where it's at too.
Okay, so you're able to pinpoint
yeah,
that.
I can pinpoint.
Could you maybe point to where you can feel that if it was hurting?
Yeah, right here.
Okay, so right along the top of
Literally
that
like
kneecap.
right at the top of the kneecap. Yeah.
Okay. And was that a gradual thing? Did it come on suddenly?
That's pretty chronic.
Okay. Alright, and anything besides squatting that bothers it?
Just any knee flexion.
Okay.
Stuff minus step ups and deadlifting.
Okay. And I see also that you had some right hip pain as well.
Mm-hmm.
Can you tell me a little bit more about that?
About like 4 years ago or something like that, I hurt my right side hip by doing a deadlift for it slip in my hand, and ever since then it's just kind of like an imbalance
Okay.
between the two, and it just feels different.
Okay. And were you treated for that before?
Yeah.
Okay.
Went to the doctor, got an MRI.
Alright, and what were the results of that MRI?
Negative.
Negative, okay.
No symptoms, no nothing.
And you've been taking care of that problem by not squatting? Is that just
Pretty
resting
much.
it? Anything else you've been doing for that? Okay.
Not really.
Alright, and I see here that you are a personal trainer and your work involves kneeling and a lot of squatting. Has this injury limited your work at all?
Not too much, just kind of an annoyance.
Okay. And I see also that you like to lift about 6 days per week. Can you describe kind of what your lifting routine is like?
Yeah. So I just kind of do like a 3-day split of like a push-pull legs, cycle on through push-pull legs, so on and so forth. And then just every now and then when I know my body needs to rest, I'll throw on the rest day.
Okay. And so when you are squatting, about how much weight are we talking?
For how many reps and sets?
Maybe about 8 reps?
Multiple sets?
Yeah.
Okay.
What you do on a typical day?
Give or take probably like 335-ish.
Okay. It's a pretty significant amount of weight there. Any other type of exercise activities that you enjoy or that you do on a regular basis?
Not too much, just mostly just weights.
Okay.
Not cardio, I'll tell you that much.
All right, and I see that you do have a family history of rheumatoid arthritis.
Yes.
And which relative is that?
My mom.
Okay. And how old was she when she first began noticing symptoms?
Maybe like mid-30s.
Okay.
Something like that, I don't know. It's been a while.
All right, and anyone else in your immediate family affected by that?
Not my immediate family.
Okay. And I see also that you have some allergies. Anything in particular that you're allergic to?
Just pollen and potentially like sulfa medication.
Okay, potentially. Have you had an allergic reaction to that then?
I have not, but my brother has, and
Okay.
my whole father's side has been sensitive to sulfa medications.
Okay. And I see that you take some DotFit supplements.
Yes.
Which supplements are you taking currently?
Oh goodness. I take a branched chain amino acid,
Okay.
a creatine, a multivitamin, fish oil, and a whey protein.
Okay.
I think that's it. Yeah.
All right.
Yeah, that's
Sounds good. And I do see that you had some broken bones and fractures.
Yes.
Tell me a little bit more about those.
I broke my right clavicle about 8 years ago. It was my junior year of high school.
All right.
And yes, I do know how to pronounce clavicle. And then I broke the sesamoid bones on the right side of my foot just by straight up running.
Okay. So
And that was about 4 years ago.
okay. And those have been well healed and treated?
Well, the collarbone is the right foot now kind of gives me nerve pain after long distance of running.
Okay.
And it's a true tingle all the way up my leg.
Okay. So do you run often?
No.
Okay.
Get that.
All right. And I see also that you have marked skin diseases.
Just psoriasis.
Okay. And I also see that you've had right labrum surgery in 2010.
Mhm.
And what were you treated after that?
Yeah, I did physical therapy for about at least 6-7 months. The doctor deliberately tightened it up because he knew me that I would actually do my physical therapy,
Okay.
and so he tightened it up even extra as he normally would, and then that made me have an extra 3-4 months of PT on top of.
So got that
Normal
all
time
taken
frame.
care of.
Yeah.
Okay.
And then and then I also have currently a left labral tear as well.
Okay.
Slap tear underneath the acromion.
Okay. So I'm assuming you've had an MRI on that.
Yeah.
Okay.
And it's just a partial, it's not a full tear.
Okay. All right, and I see that you've marked some joint pain and swelling.
Mostly just joint pain.
Okay, just joint pain at the knee, just
Just
to
joint
make
pain.
sure. All right, and I see that your goals for PT are to be able to lift without knee pain.
Mhm.
Anything else
No.
you'd like to work on? So just getting back to your normal weightlifting routine.
I'm gonna lift big weights.
All right. And is there anything else you feel I should know about your injury or your health that I haven't asked you about?
Yeah, my wife isn't very supportive of me.
Oh, I'm sorry to hear that.
That's
We'll
about
get on to our examination.